Understanding EMF, Research and Health Effects. Virtually all studies cited by telecom companies and governments looking at whether EMF is harmful or not almost exclusively investigate the thermal effects of the EMF. The ICNIRP, International Commission of Non-Ionizing Radiation Protection, has drawn up standards for this. For the inner body temperature, the standard is based on the natural fluctuation in body temperature. The standard for type 1 tissue, which includes the limbs, has been set at an increase of a maximum of 5 degrees Celsius. In type 2 tissue, which includes the head and abdomen, the natural temperature is somewhat higher, and the standard has therefore been set at an increase of a maximum of 2 degrees Celsius. In determining these standards, only the thermal effects of the EMF radiation are considered, and other negative effects of this radiation are ignored. There is enough evidence to substantiate that EMF does have harmful effects due to non-thermal effects. These non-thermal effects can be divided into two categories: the neurological disorders and physical disorders. Neurological disorders include stress, depressive symptoms, and headache. The physical disorders that are associated with EMF radiation include a decrease in sperm quality and damage to cells and DNA. These effects have been established by, among others, studied by Martin L. Pall. Pall's research has established that EMF is partly responsible for an increased uptake of calcium in cells, this so-called calcium influx. People who are sensitive to radiation and therefore have developed tinnitus can be treated with calcium blockers. These are drugs that were initially developed against cardiac arrhythmias. The symptoms of the tinnitus disappear as a result, which is an indication of the increased calcium influx under the influence of EMF.